I'm Vice Mayor Laura Pastor in the heart of the city, rockin' District 4. I am here today in District 4, and I am going to present a proclamation for the Asian American Pacific Islander Heritage Month. With me now is Zeenat Hasan, Executive Director of the Asia Pacific Community in Action. Zeenat, can you tell me what APCA is about?
Thank you so much, Vice Mayor. I am Zeenat Hasan. I'm the Executive Director of Asian Pacific Community in Action. APCA has been around since 2002, so this will be our 20-year anniversary this year. As you know, Asian Americans and Pacific Islanders have been part of our nation since its founding and part of Arizona since before statehood. So I am very proud to be the Executive Director of APCA in our 20th year now. We started as an organization mainly to serve the health needs of Asian Americans and Pacific Islanders in Arizona and to help really shape our healthcare system to address the needs that we were seeing. For example, hepatitis B. This is a vast area of disparity with Asian Americans and Pacific Islanders. So APCA started a vaccine testing and screening program to test people for hepatitis B and to provide life-saving vaccines for the community. Hepatitis B is a risk factor for liver cancer, and so if you catch it early, it is really important to preventing unnecessary death and disease from liver cancer. And so since then, we've really grown our programs to address things like breast cancer, lung cancer, smoking, et cetera. We're really focused on the public health needs of our community.
So what it sounds like is that you evolved since 2002, and now you're going to celebrate 20 years. My question to you is, what did you do during COVID? Because all of a sudden our world stopped and COVID was happening. How did you reach out to the community and made them aware of everything that was available to them, especially in the health arena? Because during that time, none of us really knew where to go, get tested, what was the vaccine about, and I'm sure you guys came into action.
You know, COVID really exposed a lot of the faults in our systems, and we lost people in our community that we shouldn't have. And so as our entire nation was preparing to address COVID, we were doing the same. We knew that people needed to have information about COVID-19 and the vaccines in languages that they speak, read, and understand, right? So we started hiring people from the community as community health workers. You may know them as promotoras. So community health workers, they are bicultural and they are bilingual in their communities, and they have a passion and a heart for serving their community. And all we did was bring people on board and provide them the training, the background, the knowledge that they needed to do to go out in community and provide that information to people. In Chinese, in Vietnamese, in Tagalog, in 10 different languages we're able to serve now, and we continue to grow that workforce.
What's exciting about that work is that people are hearing from their own, within their community, and being able to have something in their own language and feel like they're belonging and a part of a great community. What's exciting is your healthcare workers, and I know that we are fundraising, and we are fundraising so that we can have more healthcare workers within the community and be able to expand the language. Could you please tell us about that?
Yes. Of course. So community health workers, they serve as this really vital bridge between our provider healthcare systems and community because of language, because of culture, because of a variety of other factors. As you know, even when I go to a provider, it's really hard to understand and to make sense of all of the information that's given to you in the moment. That's what community health workers can do. They can serve that role to bridge providers and community. What we are trying to do right now is to train that workforce that speak multiple different languages. There are hundreds of languages in the Asian American and Pacific Islander community, and we want to train people who speak each of those languages and are culturally competent in each of those cultures to go out and really fill those cracks, fill those gaps that were exposed during COVID-19. It costs $4,000 to train one community health worker in the core competencies to really make them to create a well-trained workforce. This is a profession. These are professionals doing professional work, and it costs money to train them, and that's what we are trying to do to best serve. The fastest growing racial group in Arizona is still Asian Americans and Pacific Islanders, as it is all around the West. So we are really starting late in a way, but we're catching up. We already have a workforce of people speaking at least 10 different Asian and Pacific Islander languages, and we're only going to grow from there.
What's interesting about that is because I feel like it's very much when I was growing up as a young Mexican American, but language was very important. And so a lot of my friends who only spoke, or their parents only spoke Spanish, you would go and translate as young kids because they knew English and they knew Spanish and they were bilingual and bicultural, and they then went to these appointments. What we discovered through research was that, yes, this was a great need, and they were filling the gap. However, they were delivering important information that was either as a youth didn't understand how to translate because they're technical terms in medical fields, or it was news that then they had to process of what was happening with their parents. So I am so excited that we have evolved and that we are now filling the gap of being able to provide this service and being able to have a bridge between the medical community or the health service community and our population. This is filling a need and filling a gap within our community. And APCA's doing that. That's the most exciting part. And you've learning from also other generations of the past to be able then to say, no, this is what we need to do for our community. And not only that, to belong within our community. Because most importantly is feeling like you belong to somewhere, some space, and some place. And that is needed in the medical community, because someone like me who understands the medical community and does services, I'm still very frightful to go in and get the services because I'm afraid of what I'm going to hear. But this is really helping and opening that space of trust within the community. So thank you so much for doing that. I really appreciate that. How can people get involved with APCA? What do you need?
People can get involved by going to our website, visiting us on Facebook, Instagram, and Twitter. Send us your resume at info@apcaaz.org if you want to join our workforce. Send us a note to volunteer with our organization, and go to our website and hit that donate button and give us a monthly donation. It could be $5 or $10 or $25 every month. That will help us build this amazing multilingual, multicultural workforce in APCA for the 21st century.
Thank you so much for your great work. Thank you for building this within a community and filling a need. I really appreciate all the work and everything that APCA's doing. I'm Vice Mayor, Councilwoman Laura Pastor, in the heart of the city, Rockin' District 4.